Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful.
Hello, everyone, and welcome back to Muted in Medicine, the podcast where we break the silence on untold stories in healthcare. My name is Saba Fatima, and I'm your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face. Please subscribe to our podcast on YouTube if you're liking our content, and always feel free to give me recommendations on more topics that you'd like to see. Today, we're taking a journey beyond the city hospitals and academic centers into the heart of rural America, where access to healthcare is a daily struggle, and yet the connections between patients and physicians run deep. Rural medicine is full of paradoxes. Physicians who provide cradle-to-grave care with limited resources, communities where doctors are not just clinicians but neighbors and leaders, and patients who may travel hours for specialty care or who may forego it altogether. My guest today is Dr. Jennifer McKenney, a family physician in her hometown of Fredonia, Kansas, a community of just over 2,000 people. Since 2009, she has owned and managed Fredonia Family Care alongside her father, while also caring for patients across the clinic, hospital, emergency department, home health, and hospice. Dr. McKenney is nationally recognized for her leadership in rural health, named the 2021 Rural Health Practitioner of the Year by the National Rural Health Association, and recipient of the Early Career Achievement Award from the University of Kansas School of Medicine. She currently serves as Associate Dean for the Office of Rural Medical Education at KU, where she works to strengthen the rural workforce pipeline. Beyond medicine, she has been deeply engaged in her community as a health officer, as a school board president, as a founder of the Fredonia Medical Academy for high school students, and through initiatives like Cultivate Fredonia and the Fredonia Area Community Foundation. Her voice has been featured on CNN, CBS, MSNBC, NPR, and the New York Times and Washington Post as a leading advocate for rural healthcare. Dr. McKenney, Bacani McKenney, welcome to the show.
Thank you. Thank you for having me.
We ask everybody when we start, what's bringing you joy in medicine today?
Well, today I would say that we just had we had our clinic team meeting, and we do that every Wednesday, and it went great, and everybody is working hard and just feeling really positive about the work we're doing, and it's been a great week.
Yeah, that's awesome. I love to hear that. Usually I feel like a lot of clinicians are on the brunt of burnout, and we'll talk more about that, but that's good to know. I'm interested to learn more about your background, what led you to choose rural medicine, and if I'm mistaken, specifically to return to practice in Fredonia, so you probably trained somewhere else and then you returned back to your hometown.
Yes. Well, yes, I was born and raised right here in Fredonia. The hospital where I was born is connected to my office, so it's right down the hallway. And my dad actually was a general surgeon here for 47 years. He just retired this year, actually. And so I just kind of I grew up in his clinic and, watched TV after school in the back of the clinic and just got to know the patients and everything he did. I would go on house visits with him. I just got to know the kind of the healthcare setting here in Fredonia really well. And then I went off to KU for undergrad, and then KU Med in Kansas City for 2 years and KU Med in Wichita for 2 years. And then I did my residency at Christi Family Medicine in Wichita. I didn't actually plan always to come back to Fredonia, but there was a point when I asked my dad, I said, do you need more doctors there? And he said, yeah, I thought you were just coming back here. And I said, no, nobody's been recruiting me. So he said, oh, so all of a sudden I get a phone call from the CEO and all the people in town. And, there was a little bit of like good old fashioned Catholic guilt from my parents, like, oh, don't you want to come back and with your family? And so all of that combined with the fact that they said they would repay my loans, all that was a key part. But no, it was great. And it was the best decision I made. I signed a contract for 5 years and now I'm going on my 16th year. So.
Okay. So was there a moment in your career that you realized like that rural medicine was for you? Because initially it sounds like you didn't come with the intent to stay maybe. And what has made you stay?
Yeah, it's such a weird thing. I think we all kind of experience it. I don't know. Maybe we don't, but it's we spend a lot of our lives graduating and taking tests and graduating from something else and taking tests and so it was a little bit like 4 or 5 years into my practice, and that was about when my contract was up. And I said, well, what am I going to do now? I don't have something to graduate from. I don't have a big test to take. What's my thing? What am I going to start doing? And I really kind of went through a kind of I don't know, a whole conversation over the course of, I don't know, months maybe, deciding who I was. It was kind of like a self exploration kind of thing. I'm a woman. Do I want to really advocate for women's health? I'm a minority. Do I want to advocate for minority health? And, and I kind of said, well, I'm a rural doctor. I love what I do. I'm in my small town. And to be fair, a lot of rural doctors don't look like me. So I kind of decided, this is going to be my thing. And this is where I'm really going to push for more, more recognition of rural health, more like better workforce and things like that. And that's kind of where it started.
Yeah. So it sounds like you were getting access to healthcare before you were a healthcare provider in the town of Fredonia, and then now you're providing care. How do you think it has changed over the years? And just piggybacking off that question, what are some of the challenges that you're facing today?
Oh, sure. Well, in my time that I've been here, I've actually recruited 2 more doctors to Fredonia and a nurse practitioner, which has been awesome because it's not that easy.
Yeah.
Not many people just want to move to Fredonia if they don't have ties here, but we were able to do that. And and then we've actually seen, more nurse practitioners and stuff come into the community. So I feel like we're really fortunate in Fredonia to have great access to care. It's a town of, like you mentioned, a little over 2,000 people, but we probably draw in about 10,000 people. And so it's really good to be able to have so many people to care for everybody. The challenges, of course, are that we still, even though we're here, I think this is a common challenge even in urban areas, but getting people to us, so transportation is an issue. All the social determinants of health, like, we can keep them healthy, as healthy as we can with our medications and our education and all of that stuff. But if they're not healthy in their homes and if they can't have food and they have good living conditions, things like that, then we kind of won't be able to keep people healthy. So lots of challenges. In Southeast Kansas, we tend to be one of the poorest regions of the state. And so lots of poverty, lots of people without health insurance, higher smoking rates and teen pregnancy rates, things like that. We're not proud of it. We're working on it. Every year we make new plans on how we're going to improve. But historically, I mean, this is deep seated in this region of the state that there's been a lot of poverty over the years. So a big challenge for us, but also a lot of opportunity for us to make a big difference. And I think that's kind of what keeps us in rural health, because there's so much of a difference that we can make. Just being here and being a huge part of the healthcare community.
Yeah, and I admire you. I mean, for doing the hard work, because it's hard work, and it's hard work. I think we feel like maybe we're doing the hard work being in an academic center and tertiary care hospital, but I think you're doing the real hard work. If you just talk about rural health across America, can you think of ways like when you're providing healthcare, like there are issues in terms of access to specialties or resources or policies, and how do you navigate some of those?
Yeah, no, absolutely. Definitely I like to say we're the only gig in town, right? So you're going to get a family doc probably if you're in a rural community, which is great because we love this. We like variety. That's what we train for, is to try to take care of everybody possible in every way we can. But we're also not specialists like cardiologists, pulmonologists, oncologists. And so when we do need to send our patients over to one of those specialists, then it does get kind of tricky, because then we start talking about the transportation issues again. From Fredonia, they either go to Wichita, Kansas City. Sometimes we can get them closer within 30, 45 minutes to Parsons and Coffeyville. But it's still an issue trying to get patients there. And then how quickly can we get them in? That's we're very fortunate to have some specialists that understand kind of rural medicine and say, okay, if they're going to drive here, have them drive here once and we'll take care of as much as possible. But not everybody understands that either. So sometimes our patients have to drive to Wichita for a consult, drive back to Fredonia, drive back to Wichita for their actual procedure or something, and that's an hour and a half away from here. And it's not always an easy drive, or they sometimes can't do it at all. So specialty care is definitely a challenge. And resources, the thing I like to say about our small hospitals is it's kind of like our small grocery store. We have one of everything you need. We have like a great ketchup selection of like Heinz ketchup, but you're not going to get all these really, really fancy ketchups. You're going to get the ketchup, and you're going to get the ketchup you need. Same thing in our hospital. We have one really great CT scanner. We don't have 3 or 4 of them, but you're going to get the CT scan that you need. We have an ultrasound machine and an MRI machine, but they're not always available 24/7 because we don't always have techs, but we have them, and we'll get you in as soon as possible to be able to do those things. So we have the necessary things when that we can treat people as we need them, urgently, emergently, and just day to day. But we don't, it's not the same as kind of a big city where we might need, where we might have a lot more machines, resources, lab techs, and everybody doing all the work. But we do the best with what we can, and that kind of, I think, makes us even more kind of resilient, a little more creative sometimes, because we're going to take care of the patient. Like, don't worry, we're going to take care of the patient. We'll figure out how to do it. It just might take a little creativity sometimes.
Yeah, I mean, that's amazing, actually. You said you're the only gig in town. That means you're the only one who's seeing all the patients in the clinic, and in the hospital, you have more providers, I'm assuming.
Yeah. So in our clinic, we have, since my dad just retired, we have 3 doctors and a nurse practitioner. There's one more clinic attached to the hospital, actually employed by the hospital, with 2 doctors and a couple nurse practitioners. And then there's actually one more nurse practitioner clinic in town that's kind of separate from our practices. So again, we're fortunate to have people taking care of people, and a lot of us are from Fredonia, from our hometown. And so we're just very fortunate to have people who care that much. But, again, we're the people that you're going to see, and you're going to see us in the nursing home and the assisted living. We're the ER doctors also. I'm the hospice director. I didn't get do a fellowship in geriatrics, but I just figured out how to do it, and like you had mentioned, I'm the county health officer. I don't have my MPH, but I just figured out how to do it because, that's what we have to do. And if I don't do it, somebody else will. And we just kind of have to, like either if it's me or somebody else, we have to figure out how to do it, So one time I was asked to inspect a lagoon because the lagoon inspecting person was going to be out for a while. And I was like, how do I do that? And they said, well, here's a YouTube video and a PowerPoint presentation. So I did it. The lagoon is still there and it hasn't ruined the city. So but you just do it,
Oh, man. And it's funny you said you've been creative, but is it scary too? You won't know what will walk into the door, and you won't have the things that you need to help them. It's just amazing that you can do it all. But, obviously you have some limitations in terms of specialty. There is a limit to what you can do. Is it scary, or does it take a toll on you as well?
Yeah, it can definitely be scary. It's exciting. I will say I really enjoy what I do. Probably I would say it's more exciting than it is scary, but like this last weekend we had a bad car wreck, and when you're the ER doctor that's standing there waiting for the patients to come in because they're going to come in and it's really bad, because you hear the police scanners and everything. then you're standing there, with your one, respiratory therapist and your lab techs and your nurses, and like everybody's just kind of ready to, jump into action. Those times I think are really scary because you don't know what's going to walk in the door, but you know it's coming. And sometimes, it's probably like less scary than it is like being able to say, okay, I can do this. Like I often think about, we have a lot of orthopedic things that happen, around here. There's a lot of agriculture, farming accidents, that kind of stuff. I had one person who came in and they had stepped off their porch. And by the time she came in, her foot was on sideways, and her leg was like this. And so I called our orthopedic surgeon, that's nearby. And I just said, how do I do this? And he said, sedate her really well, sit her up, pull it down really hard. And I was like, okay, I will do that. And I did. And the foot was great. Everything worked out awesome. I, texted him to tell him I am now an official orthopedic surgeon. But, it's kind of like, I can do this. I can figure it out. I can help this patient who needs me right at this moment. And it's very satisfying, for the things that we do. But then we also have things like, we have a lot of lakes around here. So we have a lot of copperhead bites, rattlesnake bites. Those are scary because you just kind of don't know. We hold two vials of antivenom. And so it's like, okay, if they need that first one, we're probably going to ship them out. And that gets kind of scary because it's like, do they need it? Do they not? Do we give it now? Do we ship them out now? Those are kind of those, stressful situations.
Yeah. And you guys can do like heart attacks and strokes, or you have to transfer for those, like
We
strokes?
do. I mean, yeah, we kind of have to, when they come in, we just, we do our best. They go straight to the CT scanner if it's a stroke, or we get them hooked up to the EKG machine as soon as we can, if they're a heart attack, and we just do it. And we, at the same time, we've got somebody on the phone with the cardiologist or the neurologist, and we're just doing kind of everything at once because we know we have to get those people out just as soon as possible, but we have to do our part first to make sure that they're stable to do it. So, yeah, that stuff is definitely scary because it's it's life or death. It's moments. It makes a difference if I'm there doing the work and we're all doing the work together to try to get that patient to the right place, the right facility.
Do you wish like the people that you're transferring to, or the hospitals or the big tertiary centers, that they knew something? Like, do you wish that they knew something better or did something better, or there was something that was lacking while you're doing all these things?
Yes, and I'm so sorry. Of course, I'm in the rural area, so my internet connection seems like it's getting a little fuzzy there. So I would say that what I would love for bigger healthcare systems to know, whether it's a bigger hospital, an academic center, whatever, is that we rural docs are doing everything. We have to know everything about everything, or as much as possible about everything. We have tried everything by the time we are calling you. We're not just like, hey, they walked in my door, I'm going to send you this person and they're maybe fine or not. No, we're sending you someone because we literally don't have a heart cath lab here, or we don't have a neurosurgeon here. So sometimes when I call, and I'm trying to do a transfer and it's a peer-to-peer or doctor-to-doctor call, and I'm talking to them, we don't always get the best reception, and you get a little bit of kind of a condescending tone. And I would challenge any doctor at a bigger facility to come do an ER weekend with me and see how things go. Because yes, we are a small facility, but by golly, we have to know and do it all and stabilize those patients. And by the time I'm calling you, it's because we really need you, not because we needed, not necessarily because we need advice on this or that, or it's a simple thing. It's because we have done everything physically possible with the resources we have. And now we have to pass you on to the next person, or pass the patient on to the next person that's appropriate, because we just don't have them here, or the next facility that has the machine they need or the procedures they need. So I would love for everybody to know that we rural doctors are not weak of heart. We work hard, we know a lot, and and this is what we do day in and day out, and we're experts in our field. And rural medicine is a very, very particular and stressful and important field.
That's awesome. I'm glad you said that. I apologize if I've ever been condescending. I don't think so. But I do get that sense, I sometimes hear like murmurs in the hospital, when somebody was upset that something wasn't done. And I think this perspective is so important, just
Yeah.
coming from your.
And one thing I'll add to that is, we talk about how do we encourage students to go into rural medicine. And if our culture at the academic centers, and again, I'm saying this in that I love KU, Kansas City, Wichita. So no knock on anybody there. But those are still, Kansas City and Wichita. I've also, heard the murmurs, or, even in my own education and everything, or when I'm transferring people, I've heard those same murmurs, those same sentiments about rural medicine. So, but if we are to increase the number of medical students who want to go into rural health, the culture of how we teach them has to change too. We can't be teaching them that, like when you're the trauma surgeon who is picking up the phone and talking to me about the trauma patient I'm about to send you. You can't sit there and roll your eyes and be like, okay, well, this patient's coming from Fredonia, so we'll find out what they did there. I heard those things when I was a student, That's not going to make any student want to go to Fredonia or another small town, because they know what the reception is like, the culture is like on the other side, and nobody likes that. So we have to change our culture, the way we talk about rural medicine, or we will never get the access to care that Kansas deserves, or any rural, state deserves, a state with lots of rural communities. It is all about access to care. And if we're going to care for all the Kansans, then we have to respect all the communities, all the doctors that are out there doing the work, and reflect that in the way that we teach students as well.
Yeah, no, that's awesome. That was, I'm very inspired just by 10 minutes into talking into you. So I'm just going to say you're doing great work. Just shifting gears a little bit, it sounds like most of the patients that you take care of. How does that work? Like, do you like that? You don't like that? Or how does that impact the doctor-patient relationship?
I thought it would be weirder coming back to my hometown, but I love it. I absolutely love it. I will say a lot of my patients have my cell phone, and that's fine. Everybody knows where I live. I live right in the middle of town, like most of us doctors here. It's okay. People don't show up to my house for the most part, every once in a while. But I love it because there's kind of like this meaning, and this like satisfaction, or whatever you call it, by taking care of the people that took care of me when I was younger. And sometimes that is literally taking care of me, my babysitters, my teachers, whatever, but also it's just the people that made Fredonia a wonderful place to grow up. And, so maybe the person at the grocery store, or, the law enforcement people, or whatever. And just being able to take care of those people, I think really just makes what I do so much more meaningful, in any given day. And I have two kids. They're 12 and 14, and ever since they could ride a bike, they just ride their bike all over town and go to their friends' houses, and they just tell us, someone tells us where they are. But like, that's the town I grew up in, and that's the town I want them to grow up in. And if I can keep this community, if I can help keep this community, safe and healthy, that's exactly what I want for my kids. Because I always say, my kids deserve as good of care as anybody else in this entire country, no matter what the zip code is, no matter how big the city is. It shouldn't matter what our zip code is, as to whether or not we're getting good care. So part of that is just making sure my kids are taken care of, but that translates to everybody else's kids and all the generations after that too.
Does it get trickier when people are like skeptical of recommendations for vaccines? There's misinformation. Does it get tricky, and how do you navigate through that?
Yeah, that was tough during the pandemic. It was the first time in my time being back here that I felt, I don't know, I felt like these relationships that I had built for a decade all of a sudden were being kind of questioned. It's like, I've been taking care of your hypertension and diabetes for 10 years now, but you're not believing me about like wearing a mask or getting a vaccine. And can we talk about that? Where's that coming from? Or I've been taking care of your mom. I've been taking care of your kids. Like, how come you're questioning when I'm saying, you need to do this and this to keep yourself safe and keep others safe? It was trying, like a very trying time. And, and it felt a lot more personal because I think doing public health, sometimes, can be like, okay, well, I'm taking care of like this population. And it's like, if I envision it, it's a population of like little people, like stick figures or something, maybe not like specific faces, but it's a population of people that are like a big crowd. But when you're doing public health in a small town, it's literally your neighbor. It's literally the person doing your hair. It's literally, the school administration or whatever. And so it's a lot more personal. And either way, whether they're supporting you and like far and above, I felt support from the people in my small town. But as the pandemic went on, the people who were in opposition of vaccines and things like that and masks were very loud. And so it was hurtful, it was personal. And even now there's remnants of that, right? Like, hey, here are my recommendations for you. Get a mammogram, blah 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 blah. Get your flu shot. No, I don't do vaccines, blah blah. And then we have that conversation. But the nice thing again about at least we have a foundation of a relationship, so we can have those conversations to say, what are your questions about vaccines? What do you want to talk about? Because we can talk about it. I'm not going to force you to do it. Let's just talk about what your hesitations are, or if you have questions for me. So that's still at least a good thing. But yeah, it's a different kind of challenge, I think.
Plus, if you're one of the only few providers in town, like you don't want to fracture that relationship because you still want them to get access to care if they get a heart attack or stroke, which they will, but they're still going to be your patient. So yeah.
Yes, yeah. Maintaining the relationships, I think, are really important for sure.
Yeah. Is it affecting you when you think about what's happening at the policy level, Medicaid cuts, you being in a rural setting? What do you think was different? What do you think will be the impact of that?
Yes, I think it's going to be huge for us here in rural communities. Um, Anything that has to deal with Medicaid and making it more challenging for people to have or maintain Medicaid, I think is going to make access to care worse and healthcare just unobtainable for patients. So I was talking to one of my patients who is like farming wife and mom, so she's out in the fields from 6 a.m. till maybe sometimes midnight when it's harvest season. But so when it comes around that she has to renew her children's applications for Medicaid, if she doesn't do it, it's not because she's not a hardworking person. It's because she literally can't get away to sit down at a computer and get sleep and eat meals, and Medicaid applications are probably not her top priority at that point. It's just, it makes it very difficult. And that's people, that's somebody who kind of understands what needs to be done to keep Medicaid. There are a lot of people out there that maybe don't have a permanent address, don't have a phone number that they've had, for a long time where we can reach them. They don't know the changes that are happening. So the next time they show up to a clinic or to the ER, they're told, well, you don't actually have Medicaid coverage anymore. And that might be the first time that they hear of it. Or they are notified that they don't have Medicaid. So they don't come to the clinic. So they go to the ER instead. And then that puts a strain on all of our rural hospitals that are, seeing all these ER patients and not getting paid for it as well. So yeah, I think in the clinic, in the hospital, and just for the patients themselves, it's really going to take a toll.
Yeah. Do you think, is there something that you've done or thought about, or what innovations are, just to help the future of rural health? Does telemedicine help, or with the Medicaid cuts as well? Have you guys thought about something? I just wonder.
Yeah, we're always trying to think of ways to keep our hospital thriving, and so many of our hospitals are, kind of operating in the red. Every hospital, like not every hospital, but so many rural hospitals are just constantly at risk for closure. Luckily, our hospital does pretty well, but it's not. When we go through finances, it's not a pretty situation where we're making lots of money. We're staying open and we're able to care for our patients, and that's kind of what we hope for. But we're oftentimes looking for things like grant money, and of course, grants are kind of at risk these days as well, but grant money, different ways to just educate people on the different services we have. Because sometimes people don't think that we can do colonoscopies right here in Fredonia. You don't have to drive off to a bigger town or bigger city. I do them here. I'll do a colonoscopy. So advertising about those kind of things, marketing. We do swing bed, which is like skilled nursing. Some of the bigger hospitals don't send people back here for their rehab after an inpatient stay because they don't realize that we do that kind of thing here. So I think marketing is a big piece of it, and then just education to the patients themselves about hey, these are the things that are happening. Make sure that if you need help with filling out forms or renewing your Medicaid, renewing any of your healthcare coverage, we'll help you. We're here, just show up and we'll help you with any of it. But oftentimes, again, people don't realize, that that's something that we're willing to do because it's like you go in, you get your blood pressure checked, you get your medicine, you do whatever. No, we're full service. We kind of that's how we're built, is to take care of the whole patient. And that sometimes includes helping with healthcare coverage.
Yeah. Well, wow, you do colonoscopies too. Do you struggle with staffing shortages more than just rural populations struggle with staffing shortages more than, other places, you think? And have you had that struggle?
Yes. I do think because we have a smaller pool of people who are maybe trained to do things. A lot of what we do, to be honest, is kind of on the job training. We have medical assistants that work with us, and a couple of mine, started when they were 19 years old, and we just said, hey, this is how we're going to do it, and let me show you how to do it. Let me train you, and I'll watch you, and all that, and they can be some of the best people that ever worked for you. But it's just finding those people, finding those gems, in the small towns. Some of what we do, like we have scribes in our office, but they're virtual scribes because we also, we don't necessarily have all the people in town that have that kind of training. So that's something that we do as well, is look kind of virtually if we can do things that way. And then all of our staff, I mean, I think this might be true for all rural clinics and hospitals, is that our staff members are doing probably like 4 or 5 different roles. They might be the MA, but they're also sitting up front being the receptionist, or they're maybe helping with some of the billing tasks, or they're working with our care manager. Some of them also scribe sometimes. So it's just, everybody knows that we're doing everything that needs to be done, and we're not afraid to ask for help, and we're not afraid to jump in. So again, rural health, right? Even the staff in the clinic has to be creative and resourceful.
Yeah, I'm sure. Yeah. Does it ever feel, I think working in rural medicine can feel a little bit isolating. Do you ever feel that? Or how do you prevent yourself from burnout? Because you're doing a lot.
Yeah. Well, I would say, luckily these days, with just like cell phones and social media, you don't feel too isolated. Plus, we, this is my home base, but we, like to travel a lot. And so maybe if I'm not on call, I might, travel quite a bit. That's kind of my getaway. I don't like to buy like really fancy things, but I do like to go places. So
Yeah.
that kind of, gets you out of the scenario where maybe somebody might ask you for help in the grocery store or whatever, which again is not bad, but it happens every time. So, but yeah, I think the isolation piece, it definitely can happen. If I didn't have my partners with me, like who would I run to if I just have one simple little question? I just run around the corner and ask, Dr. Wells or Dr. Hauser, what is it? What do you guys usually do with this situation? That makes it hard. If you're asking somebody to go out, let's say to Western Kansas, and they're the only doctor in that town, odds are good they're not going to want to. They might not move there. They might not want to deliver babies. They might leave after a few years because of the burnout. So I think we have to really protect that too. Maybe we start recruiting, a couple people at a time instead of just one. Maybe you only need one, but two people are gonna stay there longer than maybe just one person. We connect each other and keep working together in hospitals and clinics, and make sure that we're being intentional about connecting people, even though we might not work together. Maybe we're rivals, maybe, but but it is important to kind of work together in these small communities. So yeah, not so much isolation, at least because we're able to connect in different ways, but it can get to that point, and that also is one of those barriers to getting people to do rural medicine if they're kind of the only one there. That can be scary.
Yeah. Yeah. And did you ever wish that you were practicing in a bigger city, like throughout your career, or now?
Definitely during the pandemic, I got to that point
Yeah.
because it really was. I mean, it was tough because it was like that's when you were no longer just okay with everybody knowing where you lived because
Yeah.
it got a little weird for a while, but just a glimpse of that, and then you just get right back to nope, this is the work I'm doing, this is the work I'm called to do. It's important work, and let's just keep doing it.
Yeah. What advice would you give to younger physicians who are considering rural practice? They're hesitant because of its challenges, something that you talked about earlier, as well as something we need to advocate for. So,
Yeah. So the thing I like to tell students is that rural medicine is really, really exciting. It's an adventure all on its own, and every day you don't know what's going to walk into your clinic or come into the ER. I mean, I think about I was sitting in the ER one time, and a guy walked up and said, "I think my son just got bit by a copperhead." We just talked about snake bites, and I said, "Okay, how do you know?" And he lifts up his bag, and there's an angry thing in the bag. And I was like, "What is that?" And he said, "It's the copperhead." And I said, "Why did you bring in a live copperhead?" And he said, "Well, I wanted you to believe me." And I said, "They look the same dead. Please take care of that copperhead. I don't want to know. Just take it." But you don't know what's gonna happen. So it's exciting stuff. But you also get to connect with people in ways that are just like beyond the exam room, beyond the hospital. Um, maybe it is at the grocery store, maybe it's at the football field, and on a Friday night game, and you have to help on the field, or maybe it's at church when somebody like passes out. Sometimes that happens, I think. So just being able to be there for people in so many aspects of life, I think it's kind of it makes things never boring. You're never going to get bored with rural medicine, and you can practice to your full training. Like I mentioned, I do colonoscopies. We do stress tests. We do lesion removals. We do I assist my dad with surgeries. I mean, it's just anything that we can do, and we can and that kind of doctor we can be for our patients is just better care, because they're not having to drive to Wichita to get their colonoscopy while they just drank their prep, and they're having to drive an hour and a half after chugging a gallon of Go Lightly, So like those things that we can do for our patients are just really good care, So I love it. There's a reason so many of us do it and stay with it, and just really kind of sing the praises of like what rural medicine means to us. So it's a lot of fun.
Yeah. Yeah, it sounds like it. Yeah. If you could think of like one story which you thought that at that point in time, this is what I do, why I do what I do. Can you think of a story like that?
Yeah, I think probably maybe one story that comes to mind. I get that feeling a lot, and I think that's the hard part, is like picking one story. But I in a given day, probably just sitting even in an exam room with a patient is one of the I'll get that feeling of like, yeah, this is why I do what I do. But I think about um we still do home visits from time to time, and so um I have been able to be with people, in their final breath, just at home, holding their hand, surrounded by their family. And I think sometimes those are the most meaningful times for me as well, because most likely they are somebody that I've seen for over a decade, and I've been with them in their healthy times and into their challenges, and I get to be with them when they go on to the next life or whatever, and just to be part of that and kind of be welcomed in as part of the family, spending those last precious moments with someone is like, wow, yeah, this is why I do what I do. From the beginning till now, those relationships I think are kind of key to what we do. So, yeah, it's really nice to be able to be part of people's lives and watch them, and not just watch them in our exam rooms, but watch them in the community. I'm oftentimes like I see a kid at school and I'm like, oh my gosh, I remember when you were born. That's how I know I'm old also. But people used to say that to me. But now I'm the one who says that. I'm like, I remember your first well visit. Oh my gosh, I remember when I stitched up your elbow. It's just all those little things that you get to see people grow through different phases of life and all that. And it just again makes it like this is what we do.
That's beautiful. Yeah. If you could change one thing about the way you practice medicine, and the second question is if you could change one thing that how rural medicine is perceived, you can think about it. One thing that you'd like to change and one thing you think others should think differently.
Okay, one thing I would change about rural medicine, and then what I would like other people, how I would like to change their perception of rural medicine.
Yes.
Okay. So I guess in general, rural medicine, I would love for every single community to have a doctor. I mean, very simple. I know that's like utopia. That's like ideal situation. But then let's say kind of on a practice level, what would I change about rural medicine? Yeah, I don't I don't know. That's a tough question. If I maybe, because we build these relationships over the long haul. And again, I know so many people are doing that in medicine. Everybody does that in medicine. But we still live in a world and practice in a world where you keep your doors open by churning out patients, right? You see a patient, you get paid for a patient. You do a procedure, you get paid for a procedure. We're now doing value-based care, which is great. We're trying to keep people healthier, and we're actually getting rewarded for keeping people healthier. And that's kind of newer, and I like that addition to medicine because it feels right. But if we could really just spend the time with people and be reimbursed for the time that we the care that we actually give, because what we bill for is that 15-minute visit. But what we do is the paperwork, the extra phone call, the checking in at the grocery store, the texting of the daughter to see how their mom is doing because she was with her at her office visit. That's what we do. But what we get paid for is the 15-minute visit. I know you know this too.
Yeah.
But yeah, so I would like to see it, but that's also me saying I would love a different healthcare system. But that might be a different podcast. But yeah,
You probably do it more than me because when I'm off call, but it sounds like you're not. So yeah.
No, I get it. But yeah, so I think for rural medicine, those would be a couple of things that I would think of as a doctor for everybody in a rural community. And then then for the doctors themselves doing the work, real recognition of the work that we're doing. And then as far as changing people's perceptions, I know I kind of went on a little bit of a soapbox, but yeah, I mean, I love being a rural doctor and I'm so proud of it. And when I talk about it, people start to get it, I think, what all we do. But people who don't stop to learn about what rural doctors do would be very surprised, I think, by everything we do and everything we have to do, everything we get to do. So it would be to not underestimate your rural doctor, in the town next door, and just understand the things that we're doing and the ways that we're trying to help our communities. And you mentioned kind of during my intro, just being on the school board and doing some of those things. I mean, we're, especially in rural communities, I know this happens in urban communities as well, and you guys do so much in academics as well. But you'll find us rural docs on the school boards, on the city commissions, on the Chamber of Commerce, sometimes substituting at the school, going to the PTO meetings, we automatically kind of are seen as people who have leadership skills, I would like to think, so we tend to just be asked or we volunteer to do some of these things. And so we're we're affecting the community in ways way beyond the exam rooms, way beyond medicine, I like to think. And so, yeah, I would just say I don't ever want anyone to underestimate what a rural doctor does, and that's not just what's in the exam room. It's everything, that makes the community run. And again, I don't mean to say that in a way that's like, oh, you're welcome, small town. This is what we love. Like, this is what we love to do, and we care about the community, and we know if the community is thriving, then the patients are going to thrive as well. So, and again, I don't want to make us sound like, anything more than just people who care about the communities we live in.
No, I mean, thank you so much. I think the entire conversation, it's very inspiring, and just learn so much about what you do. And I think you're probably doing it, but we should create more awareness about it. And this is why we're doing this podcast, because there's so much I didn't know. And I think I work in a some mile radius of you. So, is there something that you have said today that you wanted to say and you haven't said yet? We are going to go towards our end of this podcast.
So, one thing that I love telling my students about, any medical students and all that, is that we do, when we go into rural medicine, we have a unique opportunity to be a leader in the community. And I kind of mentioned that before, and do really cool things. And again, not just as a doctor, but just as a member of the community. And so one of the fun things that I always like to state is that I started a festival here in Fredonia, and we just concluded this last weekend, and it's called Fredonia Sausage Fest. And it's magical as it sounds. And we have all these fun events, and we have vendors, and we have a beer garden. We have, inappropriate jokes. Whole thing raises money for Fredonia. And one of the organizations I started in Fredonia is called Cultivate Fredonia. And so all the money goes toward Cultivate Fredonia, which is a community growth initiative. So some of the things that we do, we have a walking trail on the mound that we developed and we maintain, and we built like a Welcome to Fredonia sign. We're building another one. We built a skate park, just things like that. But we also buy bikes for every second grader in Fredonia. So every year, every second grader gets a bike, whether they need it or not, but they get a bike. So you can be really creative, like use your powers wisely, use your leadership wisely. But it can really make for a very satisfying life to be able to contribute again to the community in different ways. So I always have to bring up Sausage Fest because it's one of the most fun things I feel like I've done in Fredonia. And, again, if it can make the community a better place, then, let's do it. Let's try it. See what happens.
That sounds amazing. Thank you so much for sharing that. We are going to towards the end of our episode. As we close today's episode, we have a tradition to end it with a poem. It's a small poem, so if you'll stay with me from that. And it's related to rural medicine. Rural medicine, like poetry, is about finding meaning in the small and often overlooked moments of life. And it's just to remember that impact isn't measured by recognition, but by presence and the quiet ways we show up, care, and keep communities alive. It's called Famous by Naomi Shihab Nye. The river is famous to the fish. The loud voice is famous to silence, which knew it would inherit the earth before anybody said so. The cat sleeping on the fence is famous to the birds, watching him from the birdhouse. The tear is famous briefly to the cheek. The idea you carry close to your bosom is famous to your bosom. The boot is famous to the earth, more famous than the dress shoe, which is famous only to floors. The bent photograph is famous to the one who carries it, and not at all famous to the one who is pictured. I want to be famous to shuffling men who smile while crossing streets, sticky children in grocery lines, famous as the one who smiled back. I want to be famous in the way a pulley is famous, or a buttonhole, not because it did anything spectacular, but because it never forgot what it could do. Thank you so much, Dr. Jennifer McKenney, for doing this with us today.
Thank you. That was beautiful. I love it.